Margaret was thinking about her grocery list, not about what her doctor was about to say next. The paper on the exam table crinkled under her. A routine checkup at 67 years old. Then the words that changed everything. Margaret, the test came back positive for chlamydia. She actually laughed at first. A short, confused laugh, the kind that comes out before your brain catches up. She thought he'd misread someone else's chart. She hadn't been reckless. She hadn't done anything she'd consider risky. She'd simply done what millions of newly single older adults are doing right now, in every state in this country. She'd started dating again, 3 years after her divorce, met someone kind on an app her daughter helped her set up, and never once thought to ask about protection, because in her mind, that conversation belonged to a different generation entirely, not hers. Here's what almost nobody is telling people over 60. Sexually transmitted infections are rising faster in your age group than in almost any other demographic in America right now. Not holding steady, not slightly increasing. Climbing sharply year after year, while public health campaigns keep aiming their warnings at teenagers and college students who statistically are far more likely to already know how to protect themselves. And today, we're going to talk about why this is happening and, more importantly, how you can navigate this new chapter of your life with confidence and safety. Before we go further, one honest disclaimer. This video is for education only. It does not replace a conversation with your own doctor who knows your specific health history, your specific risk factors, and can order the specific tests that apply to your situation. What you'll hear today is meant to start a conversation you may have never had before, not to replace the one you should have with a medical professional who knows you personally. Now let's name what's actually driving this trend, because the numbers alone don't explain themselves. The CDC's own Sexually Transmitted Disease Surveillance Report has tracked a sharp, sustained increase in chlamydia, gonorrhea, and syphilis cases among Americans over 60 across the past decade. This isn't a minor statistical blip. This is one of the fastest growing public health trends in the country, and it's happening almost entirely outside the spotlight. So why now? Why this generation, at this particular moment in history? The answer isn't one single thing. It's several forces converging at once, each one reasonable on its own, but together, creating a perfect storm nobody planned for. The first force is what researchers sometimes call gray divorce, the sharp rise in divorce among couples over 50, a trend that has roughly doubled since the 1990s. People who spent 20, 30, sometimes 40 years in a single monogamous relationship are, for the first time in decades, dating again. And dating, for this generation, looks nothing like it did the last time they were single. The second force is widowhood, which follows a similar pattern but carries a different emotional weight entirely. Someone who loses a spouse after 4 decades of marriage isn't returning to dating with modern instincts. They're returning to it with instincts frozen in time, from an era before HIV testing was routine, before dating apps existed, before safe sex was part of everyday vocabulary the way it is for younger generations today. The third force, and perhaps the most underestimated one, is the dating app itself. Platforms designed originally for a younger demographic have seen a real and measurable increase in users over 60 in recent years. People looking for companionship, connection, sometimes just to feel desired again after years or decades of feeling invisible. There's nothing wrong with that desire. It's deeply human. But these platforms make something possible that simply wasn't accessible to this generation before, meeting multiple new partners more frequently, more easily than at any previous point in their lives. And here's where biology quietly enters the story, in a way most people never learn until it's already relevant to them. After menopause, vaginal tissue becomes naturally thinner and less elastic due to declining estrogen levels, a condition called vaginal atrophy. This isn't a flaw or a failure of the body. It's a normal part of aging. But it does mean that intercourse can cause micro-tears in tissue that are often too small to notice, and those micro-tears create an easier entry point for infection. In simple terms, The same biological changes that come naturally with age can make a person more vulnerable to contracting an STI from a single exposure than they would have been at 25. For men, a comparable biological factor exists too, though it's discussed even less. Age-related changes in immune response mean the body may take longer to fight off an infection that a younger immune system might clear more efficiently, or at least suppress the symptoms of. This matters because it feeds directly into the next piece of this puzzle, one I consider the true hidden driver of this entire crisis. Consider Margaret, whose story opened this video. She was widowed for 6 years before recently beginning a relationship with a man she'd met at her church's social group. About as far from a dating app as you can get, which matters because this isn't only an app-driven story. Months before that appointment, she'd started experiencing mild discomfort that she assumed, reasonably, was simply getting older. She'd mentioned it to her primary care doctor almost in passing, expecting to be told it was normal postmenopausal dryness. He didn't ask a single follow-up question about her sexual activity. Why would he? Margaret was 71. It genuinely didn't occur to him to ask. It took 8 months and a worsening set of symptoms before a different doctor, a gynecologist she saw for an unrelated concern, finally asked the question nobody else had thought to ask. Are you sexually active? She was tested that same day. The diagnosis, the one that made her laugh in disbelief, was treatable and straightforward, nothing catastrophic. But 8 months of unnecessary discomfort and 8 months of potential exposure risk for her partner existed entirely because of one simple, quiet, universal assumption: that people her age don't need to be asked that question. This is the second engine driving this entire crisis, and in many ways, it's more dangerous than any single behavior. It's not that older adults are behaving recklessly. It's that the entire medical system, built around decades of assumptions about who gets tested and who doesn't, has quietly excluded an entire generation from a basic, routine conversation. Research on physician communication patterns has found that doctors are significantly less likely to discuss sexual health, ask about new partners, or recommend STI screening with patients over 60 than with younger patients presenting with identical symptoms. Not because older patients matter less to their doctors, because the script in most doctors' heads, built over years of training and habit, simply doesn't include this question for this age group. The assumption isn't malicious. It's just outdated, and outdated assumptions in medicine have consequences, which means the responsibility, uncomfortably, often falls on patients themselves to bring it up first. And that's exactly where the third and most stubborn obstacle in this story lives: shame. Here's something that surprises almost everyone I explain this to. The generation currently in their 60s, 70s, and 80s grew up during an era when sex education, if it existed at all, rarely mentioned protection beyond pregnancy prevention. For many people in this age group, the entire framework around safe sex was built exclusively around one question: could this result in a baby? Once pregnancy was no longer a concern, after menopause, after a certain age, an entire generation quietly absorbed the belief, without anyone ever stating it directly, that protection was no longer necessary at all. This isn't a character flaw. It's a logical conclusion drawn from decades of health messaging that genuinely never addressed this scenario. HIV education campaigns in the 1980s and 90s were aimed almost entirely at young people and specific high-risk populations. Nobody sat down with a room full of 55-year-old married couples and explained that biology doesn't check a person's driver's license before deciding whether transmission is possible. Let me introduce you to someone I'll call Frank. 68, recently divorced after 39 years of marriage, and had begun seeing 2 different women over the course of a year. Nothing overlapping, nothing he considered inappropriate. Just a man rediscovering what dating looked like after 4 decades away from it. Condoms, in Frank's mind, belonged to a different chapter of life entirely, one that ended around the same time his youngest child was born. Neither woman raised the topic either, for reasons that likely mirrored his own assumptions exactly. Frank tested positive for gonorrhea after developing symptoms he initially mistook for a urinary tract infection, something disturbingly common in cases like his, because symptoms in older adults are frequently misattributed to other, more age-appropriate conditions. His doctor later told him something that stuck with Frank enough that he repeated it back to me almost word for word. The infection didn't know your age. It just needed an opportunity. That sentence captures something essential about this entire topic. Sexually transmitted infections have never cared about a person's life stage, marital history, or how long it's been since they last needed to think about contraception. They only require exposure. And exposure, for a growing number of Americans over 60, is happening more frequently than at any previous point in this generation's adult life, while awareness, testing, and open conversation about it lag decades behind. There's a particularly cruel irony sitting inside this trend, one worth naming directly. This is a generation that, in many cases, spent their entire adult lives practicing genuine monogamy, one partner, sometimes for their entire adult existence. Precisely because of that history, many people in this age group have never developed the instinct, the vocabulary, or even the mild social reflex that younger generations take for granted. The ability to ask a new partner directly, "When were you last tested?" It's not that they're incapable of that conversation. It's that the muscle for having it was simply never built, because for most of their lives, they never needed it. And symptoms, when they do appear, are frequently misread entirely, not through carelessness, but through reasonable, if incorrect, assumptions. Vaginal irritation gets attributed to menopause. Fatigue gets attributed to normal aging. Mild discomfort during urination gets attributed to a UTI, a genuinely common condition in older adults that shares overlapping symptoms with several STIs. This overlap means that even when someone does notice something is wrong, they often treat the wrong condition entirely, sometimes for months, before an accurate diagnosis is finally made. Testing itself carries its own quiet barrier, one built entirely from social discomfort rather than medical complexity. Walking into a clinic and requesting an STI panel at 65 or 70 years old can feel, to many patients, almost absurd, like asking for something meant for someone decades younger. I've had patients apologize before asking the question, as though requesting a basic health screening required some kind of justification. It doesn't. A blood test doesn't check your date of birth before deciding whether the results matter. This is precisely the myth we need to dismantle today, directly and without hedging. There is no age at which a person becomes exempt from needing information, needing protection, or needing testing. The biology of transmission doesn't recognize retirement. It doesn't recognize widowhood, or divorce, or the number of years since someone last worried about birth control. It only recognizes exposure. And here's the part that should genuinely unsettle you. One of these infections moves so quietly that most people carry it for months, sometimes years, without a single symptom loud enough to notice. And it's the one most likely, left untreated, to eventually reach the heart and the nervous system before anyone catches it at all. Let's get specific, because vague warnings don't protect anyone. Precise information does. 3 infections in particular are driving most of this increase, and each one behaves differently enough that lumping them together does a disservice to anyone trying to actually understand their risk. Syphilis rates among Americans over 60 have nearly tripled in the past several years, according to the CDC's National STD Surveillance Report, one of the sharpest increases of any age group in the country. This matters enormously because syphilis is often called the great imitator for a reason. Its early symptoms, a small painless sore, mild rash, sometimes nothing noticeable at all, are easy to dismiss or miss entirely. Left undiagnosed, it doesn't disappear. It progresses, sometimes over years, eventually affecting the heart and nervous system in ways that are far harder to treat than the infection would have been if caught early. The tragedy here isn't the disease itself. Syphilis is entirely curable with antibiotics when caught in time. The tragedy is how quietly it moves when nobody's looking for it. Gonorrhea and chlamydia have also risen significantly in this age group, and both share a frustrating characteristic. In many people, especially in the early stages, there are no symptoms at all. This is precisely why routine testing matters so much more than symptom watching. Waiting to feel sick before getting tested is, for these particular infections, often waiting for a problem that's already had months to develop. And then there's HIV, which deserves its own honest conversation, because the statistics here are genuinely startling to most people. Adults over 50 now account for roughly 1 in 6 new HIV diagnoses in the United States. Some of that reflects people who were diagnosed decades ago now, living long, full lives thanks to modern treatment. A genuine medical triumph worth celebrating. But a meaningful portion of that number represents brand new diagnoses in people who never expected, at this stage of life, to need to think about HIV at all. Older adults are also more likely to be diagnosed later in the course of the infection, partly because doctors are less likely to order the test, and partly because early symptoms, fatigue, mild flu-like feelings, get attributed to almost anything except HIV in a patient who doesn't fit the profile. Let me tell you about a woman I'll call Susan, 73, who had been with the same partner for 4 years after meeting him at a community dance class following her husband's death. Susan felt tired more often than usual, assumed it was simply her age, and mentioned it to her doctor mostly as an afterthought during an appointment about her knee. Her doctor, to his credit, asked one question almost nobody in his position typically thinks to ask: "Has anything changed in your personal life recently?" That single question opened the door to a conversation neither of them had expected to have, and led to an HIV test that came back positive. Susan started treatment immediately. Today, her viral load is undetectable, she's healthy, and she describes that doctor's simple question as the thing that likely saved her life. Not because the diagnosis itself was a death sentence today, but because untreated for years, it eventually would have become one. Here's the contrast that should alarm you more than any single statistic I've given you so far. Syphilis cases in this age group have nearly tripled in under a decade, and yet, national surveys on physician communication show that sexual health comes up in only a small fraction of primary care visits for adults over 60, even when the visit is specifically about a new relationship, a new symptom, or a recent life change like divorce or widowhood. Read those two facts side by side. The infection is accelerating. The conversation isn't. Here is what I want every person watching this to understand clearly. Testing is not an accusation. It is not a judgment about your character, your marriage history, or your choices. A full STI panel is a simple blood and urine test, often covered by Medicare and most insurance plans, and it takes less time than a haircut. If you've had a new partner in the past year, even someone you trust completely, even someone from church, from your building, from a support group for widows and widowers, getting tested is not overreacting. It's basic health care, the same as a mammogram or a colonoscopy, and it deserves exactly that level of routine acceptance. Prevention deserves the same plain, unembarrassed treatment. Condoms remain highly effective at reducing transmission risk for most of these infections, and their use has nothing to do with a person's age, marital history, or how serious a relationship is. Dental dams, though less commonly discussed, offer similar protection during oral sex, which carries real transmission risk that many people in this age group were never taught to consider at all. And for HIV specifically, PrEP, a daily medication that dramatically reduces the risk of contracting HIV, exists and is available regardless of age. Most people over 60 have simply never heard their doctor mention it, because most doctors still don't picture a 70-year-old patient when they think about who might benefit from it. There's also a practical, unglamorous piece of advice worth stating directly. Before becoming sexually active with a new partner, both people getting tested together and sharing those results honestly isn't awkward oversharing. It's exactly the kind of mutual respect that should define any new relationship at any age. Some of the healthiest couples I've worked with over the years describe that conversation, uncomfortable as it initially felt, as the moment their relationship actually started being built on solid ground. There's one more piece of this puzzle worth naming plainly, because it explains why so much of this stays hidden, even from people who otherwise take their health seriously. Shame doesn't announce itself. It just quietly decides on your behalf which questions are too embarrassing to ask out loud, and testing for something that shouldn't apply to someone my age is exactly the kind of question shame loves to silence. The fix for that isn't complicated. It's a phone call, a simple sentence to your doctor. I'd like a full STI panel. Nothing more needs to be said. There's a fear sitting underneath all of this that rarely gets named directly, and it isn't fear of the infection itself. It's fear of the conversation. The fear of sitting across from someone you're falling for, someone who makes you feel young again after years of feeling invisible, and saying the sentence that might end things before they've even started. I think we should both get tested before this goes further. I've heard this fear from so many patients that I've come to recognize it as its own distinct emotional layer, separate from the medical risk entirely. It's the fear of seeming distrustful, the fear of seeming inexperienced or old-fashioned, or, and this one comes up more than you'd expect, the fear of seeming like you think too highly of yourself, as though at this age, being wanted at all should be enough, and asking for protection on top of that feels like pushing your luck. Let me tell you about a man I'll call Gerald, 66, widowed for 2 years, who met a woman named Patricia through a hiking group for retirees. Gerald described the months leading up to their first intimate encounter as some of the happiest of his life since losing his wife, and also, quietly, some of the most anxious, because he couldn't figure out how to raise the topic of testing without, in his words, killing the romance before it even had a chance. He told me he rehearsed the sentence in his car outside her apartment 3 separate times before finally saying it. When he finally did say it, Patricia's response surprised him entirely. She laughed, relieved, and told him she'd been trying to work up the courage to say the exact same thing for 2 weeks. They got tested together the following week. Both came back clear, and Gerald told me later that the conversation, rather than damaging their connection, became one of the moments he trusted her most completely, because she hadn't flinched, hadn't taken offense, had simply treated it as the normal adult thing it actually was. Not every story ends this smoothly, and I won't pretend otherwise. Some partners do react with defensiveness, or hurt feelings, or accusations of distrust. But here's what decades of relationship research and simple human experience consistently show. Someone who reacts with anger or refusal to a reasonable request for testing is giving you real information about them, just not the kind of information a blood test provides. A partner worth building something with, at any age, is a partner who can hear that request and recognize it for exactly what it is: care, not doubt. If you're watching this and you're newly single after decades of marriage, or newly widowed and beginning to feel that flicker of wanting connection again, I want you to hear something directly, the same way I'd say it to my own patients sitting across from me. Wanting intimacy again is not something to apologize for. Desire doesn't have an expiration date, and connection after loss or divorce isn't a betrayal of anything. It's evidence that you're still fully alive, still capable of choosing joy after a chapter of your life that may have been defined by grief or routine for far too long. Fighting for that joy, openly and without shame, matters. The only thing that should ever accompany that joy is information. Clear, unembarrassed, adult information that lets you protect the very body that's finally allowing you to feel like yourself again. If any part of Margaret's story, or Frank's or Gerald's, Felt close to something in your own life, even a version you haven't lived yet, even a fear you're carrying about a relationship that hasn't started. I'd invite you to subscribe to this channel, because these are exactly the conversations we have here every week, without the judgment this topic usually comes wrapped in. And I want to hear from you directly, because I read every comment. Has this conversation, the testing conversation, ever come up in your life, and how did it go? Tell me honestly. Your story might be exactly what someone else watching needs to read tonight. So let's return to where we started. A woman on an exam table, hearing a word she never expected at 67, laughing before she could even process it. A man mistaking symptoms for something else entirely because nobody ever taught him to consider the real cause. A generation that learned decades ago that this particular fear belonged to someone else's life stage, only to discover later that biology never got that memo. Here is what I hope stays with you longer than any statistic in this video. Getting tested is not an admission of anything shameful. It's not a confession. It's simply what responsible adults do when they're building something new with another person, at 25, at 50, at 80. The number of years you've lived doesn't change what your body needs to stay protected. It only changes how comfortable our culture has become at pretending your body doesn't need that protection at all. Margaret asked the question that changed everything, 8 months later than she should have had to. Frank learned the hard way that an infection doesn't check anyone's age before finding its opportunity. Susan's doctor asked one simple question that likely saved her life. Gerald found the courage to say the sentence he'd rehearsed 3 times in his car, and found, on the other side of it, a relationship built on something sturdier than fear. None of them were reckless. None of them deserved shame. They were simply living, loving, and reconnecting in a world that never quite finished teaching them how to do it safely at this stage of life. Now you know what they didn't. If this video gave you one piece of information you didn't have an hour ago, use it. Call your doctor, ask for the test, have the conversation you've been avoiding with someone you care about. Subscribe to this channel and share this with someone who needs to hear it. A friend recently divorced, a parent recently widowed, anyone starting over and unsure how to do it safely. Tell me in the comments what surprised you most today. Fear and silence have never protected anyone. Information does. Go protect the life you're finally living again.